I can't believe in this day and age that this procedure is still being done on women without any pain relief. It's barbaric. Hi, I'm Lucy. This is Unfiltered Parenthood. We talk about all things parenting related, but also today I'm going to be covering a little bit more of a personal story. So, I posted just a silly little story time TikTok a couple of weeks ago, which went viral, detailing my experience with having an endometrial biopsy. I had this procedure done about 15 years ago. No, maybe less than that actually, about 10 years ago. So I'd been struggling with fertility issues prior to having my son, and I'd also been getting some pain, like ongoing pain, in my sort of uterus area around my hips, lower stomach, and it wasn't going away. So went down to the GPs, told them all about the problems that I was having. Is there anything they could do for me? And I got referred, fair enough, to the gynecology ward, got a gynecology department. I've been having spotting as well, some bleeding issues as well. And I think at the time they were suspecting endometriosis, I think, possibly. So got referred to gynecology, and they did some tests. They did some infertility tests. They did I think it's like a dye they put around you to see if there's any blockages in your fallopian tube. So they check if there's any blockages there. Everything was fine there. So they re-referred me back to my GP. This one day I went down and the GP said, I think the best thing to do is to do an endometrial biopsy. And I said to her, what's an endometrial biopsy? What do you do there? Obviously, I know what a biopsy is. I know where your endometrial layer is. But I said, what's the procedure? What do we do? Thinking she would re-refer me back to the hospital. And she said, oh, it's just a simple procedure. We actually do it in the surgery, in the doctor's surgery, that is. She said it's very similar to a smear test. Okay, that's fine. I've had smear tests before. They're not my favourite thing in the world to have, but I've had them. They're manageable. They're, I would say, uncomfortable and a little bit invasive. Having someone poking around down there is not my favourite thing to do. But I was going to say something then that I think I probably shouldn't do. I was going to say it's not my favourite thing to do unless it's my husband poking around down there, but I probably won't say that. Cut that, Lucy, in the edits, please. So, yes, she said, oh, it's very similar to a smear test. We'll just do it in surgery in here. Okay, that's fine. When can you get me in? Now, obviously, this was post-COVID and before the doctor's surgeries went to shit and decided they weren't going to give appointments to anyone. So we rebooked, I think it was a day or two later, for me to come back in and have this procedure done. Now, bearing in mind, she'd said to me, it's very similar to an endometrial biopsy. So I've gone in there prepared for absolutely nothing, thinking that it'll just be a quick whoosh round with a, and they use the little cotton swab sort of thing, don't they, to scrape a little bit and that's it. Got in there, lay on the bed, legs in the stirrups, and she says she's going to start the procedure now. It was the most painfully fucking horrendous thing I have ever had done in my life. What she failed to mention was that it is not like a smear test at all. It's not a scraping that they do. I mean, it's not just taking small scrapes of the uterine wall. It's cutting chunks, and it depends on what sort of thing they're testing you for as to how many chunks of endometrial womb they take away, or your cervix, depending on what they're actually cutting or biopsying. But they actually physically remove chunks of your womb, essentially, to the point where it was so painful. And obviously, bearing in mind, I know people have got different pain tolerances, and I get that. And to some people, it may not be that uncomfortable, it may not be that painful. But when you've already got gynecological issues going on there in the first place, you've already got pain, you're maybe already inflamed down there, I have chronic pain as it is anyway, so I'm very sensitive to certain things in my body. I'm very attuned to my body because I have pain everywhere. So to me, I'm already dealing with pain and issues down there. I don't need chunks of my endometrial layer being cut out without any pain relief. I wasn't even told to take paracetamol before the procedure, so I've gone in there literally dry turkey, cold turkey painkiller wise, because I was expecting it to be a smear test. And it got so painful to the point that I was in the stirrups and I was literally, she's obviously at the bottom of the bed. I'm here with my legs like this, trying to physically kick her out, screaming in agony, going, I can't do this, I can't do this, I can't do this, I can't take this anymore, it's hurting. And obviously, in fairness to her, obviously I know she can't just come out of me because she's got the speculum in, she's got the equipment in. It's not just a case of just get out. But all she kept saying to me was, oh, I'm nearly done, I'm nearly done, I'm nearly done, just bear with me, nearly done. The whole procedure took about 10-15 minutes, which doesn't sound that long, but when you're screaming in agony and you're in pain, it might as well be 5 years that you're in that bed or on that bed. And I'd gone down there with no support, no one. It was just me and the doctor in the room on our own, just me crying in pain. It was torture. And when she finished, took all the equipment out, and I got off the bed, sat up, still crying, holding my stomach because I was in pain. I felt like I'd been violated. I felt really vulnerable. And then when I was sitting there, she told me to just relax and gather myself because I started bleeding then as well, just to top off the experience. I popped a pad down there to control the bleeding. And whilst I was sitting on the bed, my body started like involuntarily shaking like this, and I went really cold. And she looked at me and she said, are you okay? And I went, no, I don't feel well at all. I feel like I'm going to pass out or something. I said, but I don't feel right at all. And she started to lie down on the bed. Anyway, after about 10 minutes, I still was shaking. The shakes hadn't gone off at all. And she said, actually, oh, and then I was sick on the floor. And she said, I think we need to call an ambulance for you. So she called an ambulance. They took me up to A&E. My body had gone into what they classify as cervical shock because of this. It's just like a smear test procedure. And the point of me doing this video is to raise awareness to this procedure because I posted this video on TikTok with this story time just to get my story out there. I'd noticed a few other people had mentioned about this procedure being painful, and like I say, it went viral. Semi-viral. I'm not a big TikTok creator, but it's still gathering speed at the moment. I think we're on 200,000 views or something on it at the moment, which I believe is called semi-viral. And the comments I've had in the comment section, and basically no comments in that comment section, which I will put up on the screen in the edit and show you, none of the comments are bad comments. It's full of women that have had the same procedure in the UK, USA, Ireland, Scotland, all over the country, all over the globe, that have had this procedure done and are all agreeing with me that they were basically not offered pain relief, certainly not as standard anyway. Some did get pain relief, but the pain relief varies from being non-existent at all to full-on general anaesthetic. Now, I personally think this procedure should be done under a general anaesthetic because it was so painful. I certainly think it should be an option that is allowed to be discussed with patients. The other pain relief that people are offered are things like gas and air or a sedative injection. Again, both okay and would have made a huge difference to my experience with having this procedure done. Again, my point of this video is to raise awareness to how doctors, because I don't understand, and if anyone is a doctor or a medical expert, please explain to me in the comments why you do not explain to your patients, considering your sort of first Hippocratic oath is do no harm, why you're not explaining to your female patients that this procedure could potentially be very painful. And why is pain relief not offered as a standard? We should not be having to ask for pain relief for something that is like a smear test. And there were a couple of comments in my comment section, which I'll address, said, oh, you should have asked. If you were that bothered, why didn't you research the procedure? Why didn't you ask for the pain relief? And that's my very point, is that I didn't feel the need to research the procedure, because on talking to my doctor about it, it was marketed to me as it's like a smear test. I've had a lot of smear tests. I know what the procedure is like. I know what that is like. Why would I go and do either further research on a procedure that I know is because I've had them before? That's like saying, I like coffee, but I'm going to go and research coffee just to see whether I do actually like coffee. I've had coffee. I know what coffee's like. I'm going to drink coffee. So when the procedure is told to people, oh, it's very similar to a smear test, or it's just like a smear test, then they're not going to go researching it. They're not going to go and have a look on TikToks and see what other people's experiences with it are. They're not going to ask for pain relief if they think it's like a smear test. They're not going to feel it's necessary. Most people. Because most people would just assume that a smear test is just a bit uncomfortable. Again, obviously I know people are different, but that's just generally how it is. So I had a look at the Royal College of Obstetricians and Gynecologists, and 1 in 3 women report severe pain during hysteroscopy or endometrial biopsy procedures. So 1 in 3 equates to about 7 in 10 women, or higher sometimes. So it's not just that this is a rarity or a one-off. It seems to be that most women experience severe pain. There is a couple of sites that I've found that are trying to campaign against this, so I'm going to give a shout out. So there's Campaign Against Painful Hysteroscopy, or CAPH, and they have over 5,000 testimonies of trauma and violation during these procedures. Another one is Hysteroscopy Action UK, who are also campaigning for change on this procedure and the pain relief that is offered around it as well. So I'll put the links to those in the notes below. Again, on the things that I found here, it's just shocking, really. Women receive inadequate analgesia pain relief compared to men despite similar or higher pain levels. So what they're saying there is that the pain levels of the procedures are similar and or higher than the procedures that men have, but we as women for some reason are not offered pain relief. Women in emergency departments have longer wait times for pain treatment over men. Now, obviously, I'm not going into this is like not a man bashing thing. This is not the point of my post. It's just a comparison to show you the differences and the inadequacies between male and female care, especially when it comes to things like gynecological care. 90% of women in pain studies endure pain lasting over a year, which is often dismissed, whereas men get seen quicker and are treated quicker. Endometriosis diagnosis, the average is 8 years and 10 months before a diagnosis of endometriosis. 8 years and 10 months. And 74% of women attended multiple GP appointments before diagnosis or even being referred. And 78% of women face skepticism about symptoms. This, I'm pretty certain all of us have had at some point as women, but also as someone that has chronic pain and chronic health problems. The consistent medical gaslighting from doctors and consultants and hospitals and GPs and nurses, everyone. The gaslighting is absolutely horrendous. I, like I say, have been chronically ill for most of my life. When I was 17, I ended up having a 2-point blood transfusion because I was very iron deficient anemic. And it just fell apart from there. I've had my thyroid out, my gallbladder out, suspected lupus, chronic regional pain syndrome, fibromyalgia, just ongoing problems with various things, and then combine that with like over 10 years of infertility as well before I had my son. And I've been told, oh, I know I'm overweight. I've always been a bit on the chunky side, but I've got specifically more overweight since I had my little boy and lockdown. Not that's an excuse, but I'm aware that I'm a bigger girl. I get that. But most of the time it's, oh, you need to lose weight, or have you tried more sleep? Like, really? That's your medical diagnosis, is it, doc? To my inability to get out of bed in the morning and wake myself in the morning out of pure exhaustion and sheer just unable to move, your advice is get more sleep. You don't think I haven't tried that? Pain relief for fibromyalgia, non-existent. It turned out it was my thyroid. My thyroid was like really, it started off being hyperactive, and that's why I had to have it out, because it wasn't being controlled. I lost a absolute shit ton of weight without trying. Went down from like a size 16 to a size 8, which at 5'8" was a little bit too thin for me, and there was no reason for it. So I had my thyroid out, diagnosed with Graves' disease, and then I've been gaslit by the medical community for most of my life. I think most women will understand that. If we have a look here on gender pain gaps, so this is another thing that I had a look at. So vasectomy procedures are more aggressive. So vasectomy procedures, you get more aggressive pain management than gynecological procedures. Why? Why? Why are women not being given adequate pain management than men? Women's pain is constantly dismissed as psychological unless it's validated by a male companion. This again is on the, I'm going to put all the links to where I've got all this. This is not like my opinion. But yeah, it tends to be that if you go in as a woman to the GP or the doctor, it's, oh, you're probably sure you're not like over exaggerating. You're not exaggerating your pain. But if you went in with your partner or your husband and they said she's been in agony, she's been rolling around on the floor, she can't do this, she can't do that, it's more likely to be taken seriously at the GPs, which is shocking.
I know you told your friend you're not okay, and tell me what's wrong and why you never said you felt that way. And guess you're trying to stay strong and fake a smile until I look away. But I've known you too long, it hurts to watch your blue eyes fade to gray as you fade away, as you fade away.
Yeah, I'm about to fade away, cause every time I wake up I feel like it's Monday. Something's going wrong with all the chemicals up in my brain. All of a sudden I don't look at anything the same way. Gotta build up of my thoughts sitting in an ashtray. I'm sorry that I'm so inconvenient, okay. Just let me be me and I'll stay out of your way. I can see the way you look at me, I'm such a disgrace. I never really asked to be brought into this place. You wanna love me? Well then baby I have a taste. All the highs and the lows, no you'll never be the same. I don't really wanna hurt you but I can't control the pain. If you're sticking by my side maybe we could be okay. Okay, maybe you could be the change I need today. I promise that I've never felt.
I thought it would be fun to have a look and see what the NHS specifically says about endometrial biopsies. How do they tell people what an endometrial biopsy is? So this is on bradfordhospitals.nhs.uk. Again, I'll put the link in the bottom. What is an endometrial biopsy? I'm going to put this on screen as well. An endometrial biopsy involves removing small samples of tissue from the lining or endometrium of your uterus or womb. An endometrial biopsy is usually performed for the following reasons: heavy periods or bleeding, vaginal bleeding after menopause, unexpected bleeding while taking hormone therapy, pelvic ultrasound showing an abnormally thickened endometrium, to assess your response to treatment if you have endometrial hyperplasia. It goes on to list the benefits. Are there any alternatives? What does the procedure involve? An endometrial biopsy is usually performed without anaesthetic. However, if the procedure is difficult or you are uncomfortable, your healthcare professional may offer you a local anaesthetic or sedation. The procedure usually takes 8 to 10 minutes. First, that's BS because I was on the table for about 10-15 minutes, and as I say, I was screaming in pain and was not offered a local anaesthetic, nor was I given the option of sedation. Your healthcare professional will use a speculum to view your cervix. They'll then pass a narrow plastic tube called an endometrial sampler through the cervix into your womb. Once the endometrial sampler is in your womb, your healthcare professional will take samples by pulling out the middle part of the sampler, which creates suction. This gently rotates or moves the sampler inside your womb to collect tissue. I'm going to show you a video afterwards of how this is actually done. Complications are rare, but if they can happen, can be serious. Pain, feeling or being sick, bleeding, infection, a small hole in your womb made by one of the instruments, which with possible damage to organs nearby or tissue, or a failed procedure. You may have some vaginal bleeding that lasts 1 to 2 days. You may get cramps similar to a period, but all very null and void, basically, as a procedure.
Ever heard of a test where doctors literally vacuum out a piece of the uterus? Yep, that's what an endometrial biopsy is. Here's how it goes down. You're lying back, legs in stirrups, and a speculum slides in. A regular pelvic exam. But then, the doctor threads a thin, bendy straw through the cervix, right into the uterus. Watch this in the animation. See that tube sneak in? Then, with light suction, it pulls out a tiny chunk of the uterine lining. Just a few seconds of cramping, patients say it feels like an intense period cramp that sneaks up on you. Here's the twist. Despite how common it is, a lot of patients are never offered pain relief beyond take an ibuprofen, and doctors still argue if numbing shots or anesthesia should be standard. Look at this animation. The tool is literally scraping tissue, yet most people walk in thinking it's just a quick test. So here's the question. If you knew the pain could be this sharp, would you still agree to it without anesthesia? Tell me, worth it for answers, or should medicine do better?
So there you have it. That's how the procedure's done. So I would love to know in the comments if you've had this procedure done, or how was it for you? Or are you actually having this procedure done? Are you needing to have this procedure done and you've got some questions? I obviously, with the point of the episode, I didn't want to frighten people that are having this procedure, because I will stipulate that this procedure is done generally because there's something going on. And I don't want people to be put off having this procedure because it's painful. What I want to do is get women to advocate for themselves and be aware of how painful this procedure can potentially be, and therefore actually go and speak to their GPs or their consultants or hospital about it and advocate for themselves to get some pain relief for it, and not be fobbed off with the excuse of just take a paracetamol before you come in. I want women to be able to go in confidently and be able to say, I would like this procedure done, or I need this procedure done, but I'm not having it without pain relief. I'm not willing to take that chance. I would like it done under a general, or I would like it done under a local anaesthetic, or have some gas and air or sedation. Yes, if you've had this procedure done, or you're going to be having this procedure done, please let me know in the comments your experiences. As I say, any stories that I have, I am going to be compiling and putting together with your permission and sending to the relevant people. I am trying to get this put into movement. I know there are other people that are doing the same thing. So yes, please, if you're happy to share your story, please do. If you do want to just write a comment, just put, please don't use my story. But if you are happy for me to use my story, please let me know. You can send me an email with your story to virtuallylucyva@gmail.com, and I'll pop that on the screen there for you as well. Yes, please let me know your thoughts, and we'll see you in the next episode.